Last year, President Biden promised to make access to abortion pills easier after the Supreme Court overturned Roe v. Wade. And just last week, the Food and Drug Administration made that possible by finalizing a rule change that broadens the availability of abortion pills. The change allows the abortion drug to be prescribed over the phone or online and sent through the mail without a patient even being seen by a physician in person. And for the first time, these drugs can now be dispensed by brick-and-mortar pharmacies around the U.S. The American Association of Pro-Life Obstetricians and Gynecologists has joined a group of a health organization to challenge the FDA's authorization. Joining us now to talk about it is the CEO of the American Association of Pro-Life Obstetricians and Gynecologists, Dr. Donna Harrison, and one of the attorneys representing them in the lawsuit, Senior Counsel for Alliance Defending Freedom, Eric Baptiste. Thank you both for joining us. All right, a lot of people concerned about this switch that the FDA has now made, Dr. Harrison, because the FDA, they approved this in 2020, but said that there were so many safety measures and concerns because of the risk involved that you had to go see your physician first. So what has changed now that you can do this over telemedicine or over the phone?
They stopped tracking complications. So the FDA in 2016 simply said, we don't want to know about any complications from any of the policy changes we've made. We just require abortionists to report deaths. So there have been sweeping changes made, and the safety restrictions have been loosened. And even the original safety restrictions were inadequate to control this drug. So what you have now is a dangerous drug that is now going to be available by prescription and by telemedicine. So somebody in New York can call a prescription in to a pharmacy in Illinois and have a woman pick it up. But the question is, who's going to handle her complications when she bleeds, when she has a massive infection? Where is she going to go to get treated? The pharmacist certainly can't do that. And the telemedicine doctor never screened her for ectopic pregnancy, which is 1 in 50 pregnancies. And if a woman has an ectopic pregnancy, the Mifeprex pill doesn't work. So the ectopic pregnancy grows, and she has pain and bleeding from a ruptured ectopic pregnancy. Women have died this way. And who's going to tell her
how
exactly?
serious these side effects are?
So the side effects are serious. I mean, if you have a woman who is, say, 9 weeks pregnant, she may have about a 1 out of 20 chance of having a need for an emergency surgery to remove the tissue left inside. But if she's just a month later, if she's 13 weeks pregnant, she has a 1 out of 3 chance. There is no way you can tell over the phone whether or not a woman is 9 versus 13 weeks pregnant. That requires an ultrasound. And there is no ultrasound being done here, and nobody is watching these women. And what's even worse is women who are Rh negative, like O negative or A negative, need a medicine called Rogam whenever they miscarry, whenever they abort, or whenever they give birth, to make sure that they don't have a problem in a subsequent pregnancy. But no one will be there to give these women Rogam. So this is medical and scientific malpractice, and the FDA is allowing it to happen, and that needs to stop.
Okay, so Eric, you all are challenging the FDA's new rule. Do you see this as a political shift opposed to a medical shift?
Politics has triumphed over science since day one of this drug's approval. From the waning days of the Clinton administration in the year 2000 to the waning days of the Obama administration in the year 2016. And again, since Biden took over, we have seen the politicization of science here. And this is just the next step of choosing politics over the safety, health, and welfare of women and girls.
So what is the likelihood? I mean, what are you hoping to get from this lawsuit? Will something actually change?
We're very confident in our case. The FDA has been entrusted by Congress to protect the American public from dangerous chemical abortion drugs. And here they have failed America's women and girls by approving a dangerous regimen and a dangerous drug. And they had certain legal requirements to adhere to, and they failed to do so. In particular, they never studied the safety of these drugs under the label conditions of use. So we don't know how they actually are safe in the real world, nor have they ever studied the safety of these drugs on teenage populations. Even though this drug has been approved with no age minimum or no age restriction, we don't know. But the FDA has been compelled and required by the law to do so, and they've refused to do so for the last 2 decades.
Okay, so Dr. Harrison, we know that the majority or half of abortions in recent years are actually done through chemical abortion. So what does this actually mean now that the FDA has removed this restriction for the abortion industry? Only about a minute left.
Well, the abortion industry is pushing for over-the-counter complete freedom of access for this drug. It's a profit issue. And what you have is a dangerous drug that is now going to be able to be used on women who have never been examined, who have no idea of what their risks are. And we really don't even know if the woman who is on the other end of the telemedicine visit is the woman that's going to get the drug, because there's no way to guarantee that somebody, a pimp, an abuser, wasn't standing on the other side of the laptop. So what we have is a dangerous drug that is willy-nilly being pushed on the American market, and it needs to stop. It has to stop.
Dr. Harrison, Eric, thank you both for being here. Appreciate your insight. We'll have to check back in with you on that lawsuit.
Thank you very much.
Thank you.